Hey everybody, I hope we have all recovered from the cold weather, the Eagles loss, whatever affected you this weekend. I'm Dr. Heather Moore, owner of Total Performance Physical Therapy. We are going over tonight knee pain, weak hamstrings and knee pain. Going to discuss how those two go together. As always, make sure you like, comment anything you want to see. We also have a bunch of videos on our YouTube channel, Total Performance Physical Therapy. All you gotta do is go over there and subscribe and you'll get our updates over there also, or like our page in Facebook so you can know when we are going live. So tonight we're gonna talk about weak hamstrings and knee pain. As in most of our videos, we talk about how everything is linked together. And unfortunately, when it comes to knee pain, there's no truer statement, because where at the hip or at the shoulder, you have specific muscles that really only operate the knee, or really only operate those joints. The knee, all the muscles that attach to the knee also attach at the hip, or they come down and they attach at the ankle. So it's a very dependent joint on the hip and on the knee. So having weak hamstrings, it can definitely lead to knee pain. Is it the only one? Probably not. Usually when we're talking about muscle imbalances, and when we're talking about a weakness, or we're talking about a tightness, that is in fact a muscle imbalance. We call that just the broad category of a muscle imbalance. It's up to us to figure out exactly where that muscle imbalance lies. Most people though have a deficiency, and they have a stronger quad, which is the front muscle, and they have a weaker hamstring, which is the back muscles. Now, the quadriceps in the front of the leg, just like the hamstrings in the back of the leg, are groups of muscles. So it's not just one muscle called the quad, and it's not one muscle called the hammy or the hamstring. There are groups of muscles that make up those. But for tonight, the purpose of tonight, we're going to talk about the hamstring collectively. We're going to talk about all the muscles that make up the hamstring collectively. So most of you have a stronger quad than you do a hamstring. Any type of muscle imbalance causes, or can cause pain, can cause limping, can cause issues. So just having that weakness can cause an issue, absolutely. So what happens is when you're going up or down the steps, or you're walking, or you're running, your quad's going to be used more. You're going to be more what we call quad dominant. That's going to cause you to run a little bit differently. It's going to cause you to walk a little bit differently. It's going to cause that knee to react a little bit differently, because it doesn't have those hamstrings to pull it back. It doesn't have those hamstrings to put it in its place. So the quads are constantly outshining the hamstrings. Well, with that particular movement, you're going to wind up with a more quad dominant walk. You're going to wind up stressing more structures in the front. So if you have below kneecap pain, underneath the kneecap pain, that could be because you're really putting a lot of stress on the quad, which comes down and attaches at the bottom of the kneecap. So as you are walking, or as you're running, or as you're going up and down the steps, that quad dominant posture, that quad dominant walking is going to bother the knee over time. This is not something that is an instantaneous type of injury or an instantaneous type of pain. This is something that you may have noticed going on for a while. Oh, you started to have a little trouble walking down the steps. Maybe it was only every once in a while, now it's every day. However, usually when there's weak hamstrings, there's other muscle imbalances, because while your knee has a front and a back, it also has two sides. So you've got to have everything kind of working together. And unfortunately, where there's one muscle imbalance, there's generally more. So when we talk about IT band tendonitis, again, if you go to our YouTube channel, you're going to notice Total Performance Physical Therapy, that we talk a lot about IT band tendonitis. That's another muscle imbalance. If you have weak hamstrings, most likely you're going to have a tight IT band. So if you wind up getting help, or you wind up Googling this weak hamstring, and all you do is just stand there and do hamstring curls, you're not doing yourself any justice. You generally are not going to be able to correct just that one muscle imbalance, because that's not all there is. We also have to figure out is, are your hamstrings tight? 90% of the time when there's a weak muscle, there's a tight muscle. So when you go to strengthen your hamstrings, if they're not properly loosened up, you're going to wind up strengthening only a portion of that muscle. as opposed to the entire muscle. Now this does not mean have somebody jam your leg back into a hamstring stretch until you cry uncle. It means that you're going to have to figure out, is that a short muscle? Is that muscle have a lot of knots in it? Why is that muscle not at the proper length? Weak muscles are generally shorter muscles, which need to be stretched, which need to be foam rolled, which need to be worked out. It's not as easy as saying, okay, here's 30 hamstring curls, go do it. You've got to figure out all of the muscle imbalances. I wish it was as easy as saying, here's knee pain, go do some hamstring curls. Oh, now your knee pain is going to go away. It may help it improve, it's not going to help it go away. You got to figure out if there's something going on in the adductors, all right, the groin, the inside of your leg. All of this has to be working together in order to make that knee function properly. Then you have to look at the foot. Is the foot collapsing? Is the foot in good position? Is the foot muscles strong? So all of those could also be affecting the knee. So while the topic started out weak hamstrings, knee pain, it's really important to understand that knee pain is generally never one thing. It's generally the cause of significant muscle imbalances in that hamstring, in that IT band, in that adductor. You've got to address all those issues in order for you to have success in getting rid of the knee pain. Just going in and doing hamstring curls is not going to do you justice. The other thing about doing hamstring curls is most people do them wrong. You wind up activating a lot of your back muscles in order to be able to lift the weight, and that's not what you want to do. I'm going to show you a couple of hamstring exercises that you can do to strengthen your hamstrings, specifically strengthen a little bit of that hamstring muscle, but you don't want to exclusively work on the hamstring. You're going to look at the glutes. You're going to look at all the, not the quads, but the outside of your leg, the adductors, the abductors. You want to look at all of those things when it comes to strengthening. Just doing these hamstring exercises will strengthen your hamstrings, but if you're just worried about knee pain, you want to figure out all of the areas that knee pain is coming from, and we do offer free consultations with a doctor of physical therapy. All you have to do is call our office at 215-997-9898. We'd be happy to take care of you to determine how or where that knee pain is coming from all the different sources. It is never one thing. If you have a diagnosis of knee pain and you have one thing on its weak hamstrings, not solved. Don't consider it solved. That's not the case, all right? But let's go through some of those hamstring exercises you could do. So the first one is a simple hamstring curl. You want to stand here, and you want to kick your butt, and then you want to lower it. Now, a lot of times with a hamstring curl, people will do this, more of a marching motion. That's not getting your hamstring. Getting a little bit, but not really. You want to make sure your legs stay flush, they stay in line, and then you're just going to curl your leg up and kick your butt. You don't want to do this, okay? That's not doing anything. You want to go up slowly and down slowly. You want to do about 3 sets of 15 of these. Once you can do those nice and easy without cramping, then you can start to add some leg weights or maybe put a band on the end of your ankle. Either of those are beneficial, but don't start adding weights until you know that you're able to maintain proper posture and do this. And you're not doing this and you're not doing this. So most of us will get a cramp just from going up and down nice and easy. I would say go up to a count of 3, come down to a count of 3. The next exercise that you can do to specifically strengthen your hamstring is you're going to do just a single leg lift. Now, this one's a little bit more difficult because people like to do this. Lift the leg out back, bend forward at the waist. That does nothing. You want to keep everything here straight. So I like to compare it to one of those little birds that used to like dip their head in the water. You're just going to put your leg straight back and then lean forward. The leg will drive the body, okay? So don't move this first and then the leg. Let the leg go first and then the body. You also want to make sure that your hips are nice and straight. So you want to make sure that you are not doing this, okay? So the hips don't rotate. Everything stays in line. And then you're just doing that nice and easy. The next hamstring exercise, or the final one we're going to do, is we can do one of two things. You can do a bridge, you can do sit to stand. So with sit to stand, it's like a squat, but you're really going to concentrate more on the backs of the legs. So you're gonna almost lift your toes off the ground, and then you're gonna come up. So your toes are lifted. You don't wanna come up pushing through your toes. You wanna come up pushing through your heels, and then you're gonna sit back down. If you don't need to sit and you can just touch and then come back up, that's even better, okay? You don't wanna do this where your knees are going forward of your toes. You wanna, literally if you can, lift your toes up off the ground and then sit back and touch and come up. You are gonna feel that a little bit in your quads, but if you're doing it correctly, you're gonna feel it in your hamstrings. To emphasize your hamstrings, you wanna push through your heel. So if you're doing a lunge, if you're doing a squat, whatever it may be, put the pressure through the heel, not through the toes. That will emphasize the hamstring more than the quad. If you or someone you know is experiencing knee pain and wants a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898 and we'd be happy to get you in. Thanks and have a good night.